Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government fumigates government establishments in Yobe State as part of COVID-19 containment plan. African Union to drop plans to procure vaccines from India's Serum Institute switches to Johnson & Johnson. And India's Maharashtra state runs out of hospital beds as it enters second wave of pandemic. The Nigeria Center for Disease Control, NCDC, is reporting an increase in the number of cholera cases across states and advising all to take precaution to prevent the spread of the disease. Cholera is a waterborne disease spread by contaminated food or water. Meanwhile, the coronavirus is still raging globally with over 75,000 cases already recorded today, according to the Johns Hopkins Coronavirus Resource Center. Now, daily infections increased last night in Nigeria from the previous day with 110 new cases without a reported death for almost a week. The new cases are reported from 11 states, with Lagos and Yobe states recording the highest figure of 24 new cases each. The FCT recorded 16 new infections. Others include Bayelsa 10, Rivers 10 as well. Same with Kaduna. Nasarawa State recorded 5 cases, Akwa Ibom 4, Bauchi 3, Kaduna 3 as well, and Plateau 1. Total number of infections in the country stands at 163,440. According to the agency, more people have recovered from COVID-19, including 158 patients, increasing the number of recoveries to over 153,000. In Africa, over 4.3 million confirmed COVID-19 cases have been recorded and more than 114,000 deaths, according to Africa's Centers for Disease Control and Prevention. And now to Nigeria's vaccination update. Kogi State has now become the last state in Nigeria to flag off the vaccination exercise. Well, this is coming a day after receiving 16,900 doses of the Oxford AstraZeneca vaccine from the federal government. According to a tweet via the National Primary Healthcare Development Agency, the State Commissioner for Health, Dr. Saka Audu, and the Executive Director of Kogi State's Primary Healthcare Development Agency, Dr. Abubakar Yakubu, led frontline workers to receive the first shot of the vaccine. Almost 1 million Nigerians have been given the first dose of the AstraZeneca vaccine, as the country aims to inoculate 40% of its population this year and 30% more in 2022. The federal government, under its agency, the Federal Fire Service COVID-19 response team, has commenced the fumigation of government establishments in Yobe State as directed by the Presidential Task Force Committee on the Coronavirus. Leading the team, the state commandant of the agency in the state, Mr. Bobo Ilia, explains that over 29 government officers have so far been fumigated against the deadly disease, and plans are underway to fumigate 17 local government secretariats. He further stresses the need for residents to observe the NCDC safety measures so as not to contract the virus. As at today, Yobe State is one of the least states with 372 confirmed cases after Zamfara and Kogi State.
It is not only here in Damaturu, but the decision is a national decision from Presidential Task Force on COVID-19. It's a directive from the President. He took that decision, and he said it is worthy that Federal Fire Service should carry out this disinfection all over the country, the 36 states, including Abuja. Yobe is not exceptional. Yobe, so far today, we have covered almost 28 to 29 premises in Yobe State. It is all, including all the local governments, only that for now, the first phase of this disinfection is only within the city center. But the second phase, we are springing out to local government. I have a relation that this thing affected So I always urge people to stay clear from all other protocols. Wash your hand, put your face mask if you are going out, stay far away from each other, observe all the COVID-19 protocols so that you will be safe.
Well, the African Union has dropped plans to secure COVID-19 vaccines from the Serum Institute of India for African nations and is exploring options with Johnson & Johnson. The head of the Africa Centers for Disease Control and Prevention, Mr. John Nkenga Song, says the institute will still supply the AstraZeneca vaccine to Africa through the COVAX vaccine sharing facility, but the African Union would seek additional supplies from Johnson & Johnson. The statement comes the day after EU and British medicine regulators say they had found possible links between AstraZeneca's vaccine and reports of very rare cases of blood clots, but they reaffirmed its importance in protecting people.
Vaccination program, predictability of availability of vaccines is very, very important, so that you know when and how to use your first doses and how to counsel people that have received their first doses to come in and get their second doses there. But again, as I said last week, the situation with the Serum Institute and the government of India imposing restriction, it makes it very complicated for our vaccination program across the continent. And it's not because of the reasons now, but it's because we work very closely with COVAX. I mean, since the first doses were agreed that COVAX will get those doses and start with the vaccination program, we now shifted our efforts to the Johnson & Johnson arrangements, and that is what led to the agreement of last week, so that the Serum Institute was enabled to be able to supply doses to the COVAX mechanism. Again, that close coordination and partnership with COVAX is very important for us. So we didn't drop the deal, but it was just a clear understanding of how not to duplicate efforts with the Serum Institute, so that we complement each other rather than duplicate efforts.
Prime Minister.
Well, as with many countries around the world, Nigeria, Africa's most populous country, has had to contend with the impact of infodemic on the coronavirus pandemic. Well, at the beginning, fake news became widespread. It threatened to overshadow efforts to contain the spread of the virus. But where are we now with that? Well, joining us in our Lagos studio is Mr. Ken Ubuchie, Social and Publicity Secretary, Nigerian Guild of Editors. He joins us now. Thank you for joining us on the program.
My pleasure to be here.
All right, let's go down memory lane. Fake news and then health. 2014, we had the Ebola outbreak. Government had to contend with, I think what went viral at the time was drinking and bathing in salt water. I mean, that led to 2 deaths in Plateau State, Jos, I believe. Did Nigerian health authorities, government, I mean, did we learn from that experience coming into a pandemic like COVID-19?
I think we must have learned because the one thing you must also understand is that human beings, some human beings are not rational in their thinking, no matter what you preach, no matter the information you bring to their disposal. The point remains that after the Ebola incident, and there was this fake news that spread, people should drink salt water and bathe with it, and they'll be okay. But people say contracted Ebola, even after bathing in so much of salt water. That tells you that there was no remedy there. But I expected the government to also have stepped up with information dissemination, national orientation in the area of health. That's where we're failing, actually, and that's where the media also comes in, because we in the media, we are to disseminate information. And the information we disseminate is not what we manufacture. We disseminate information that's available. It's what government dishes out, what the experts dish out to us, that we dish out to the public. We are not health practitioners. We are not experts in health. But it is what, when we go to interview the experts, it is what they tell us that we tell the public. We interpret it and break it down for the public. That's what we do. The Ebola incident shows that, well, government may have learned, but not learned enough. Because when the COVID-19 struck, I expected a high level of information dissemination and national orientation. even in all the languages, I mean, the major languages we have in this country, at that early stage. But we didn't do that. It has people, that's why people jump on the bandwagon of fake news. And you know, the thing about fake news that it spreads faster, because it appeals to the sensibilities of the people. That's what they want to hear, that this thing does not exist. Something that will take away fear from them. Fake news succeeded in taking away fears. Although it creates fears in some, but it also helped them to, in fact, the fake news that became, well, the one that people bought over immediately in Nigeria was that there was nothing like coronavirus. Then people said, okay, even what they say we should use to wash our hands, disinfectant, has alcohol. And they said, okay, if it's about alcohol, why not we just keep drinking the alcohol? And people went on a binge. But you know, at the end of the day, people say contracted it. So there is actually a gap between the government and the people in terms of information management. And that's, I'm not going to blame the media, I'm going to knock the media, not at all.
How about social media?
Social media actually contributed so much. I know the thing about social media is this, and that's why I want people, beware of where you go. In terms of information feed, to me, it's caveat emptor, buyer beware. Mind the sites you visit. Mind who you listen to. Because the cheapest thing to do now with technology at our disposal is to create videos. We can create a fake video with you talking. It will be real you, but they will change your voice, change your message, and it's still the same you with a channel's logo at the background. And they will spread it that this is emanated from channel television. It's very easy to create sorties these days with technology. So technology has also helped to swell fake news, and technology also helps to disseminate this fake news. So it travels faster. But in the case of this COVID-19, the original hesitancy was because of the way the Nigerian government handled it. Government came to the forefront of COVID-19 information management. And you know there is a distrust between the people and the government. Once somebody sees a government official, even leading a group, there is that suspicion that it's all about money.
So looking at the cases we have now as we wrap up, what do you see government doing?
Of course, to intensify the information dissemination, to use all the available channels. And at the level of the Nigerian media, we have been able to partner with some experts. For instance, the Nigerian Guild of Editors is having a partnership with the Nigerian Academy of Pharmacy. And yesterday we had a press conference. From Monday to Saturday next week, we're going to have every day a conference via Zoom, educating people, busting the myths. All those myths, we are going to bust them with the help of the experts, so that people will know what is real and what is unreal. Sometimes there is this epidemic of information on your phone, and you don't even know what to believe. They will tell you it's for CNN. It's not actually for CNN. It's not from channels, not from NT or any other. It's actually created in somebody's room or in the mind of somebody and pushed to the public. And because it appeals to what the people want to hear, that there's something like this, people tend to buy into that. But if you want genuine information, that's what I tell the public, go to the right places.
All right.
Don't visit fake sites. There are fake sites, you know them. You know where you visit to get those things. So avoid those ones. It's caveat emptor, buyer beware.
We appreciate your time. Thank you so much, Mr. Ken Ugochie, Social Publicity Secretary, Nigeria Guild of Editors. Thank you for joining us on the program.
Thank you very much.
We still have more on the myths and facts of COVID-19. Join us again. South Africa has secured 31 million single doses of Johnson & Johnson, as well as 20 million two-dose Pfizer vaccine as it moves forward with its COVID-19 vaccination rollout plans. Health Minister Dr. Zweli Mkhize went on a tour of some vaccination centres in Johannesburg today, where he gave details on efforts to see the rollout plan through. He also reacted to yesterday's court ruling on the use of the restricted drug ivermectin for COVID-19 treatment.
After weeks of not so adequate updates on the progress made with the country's vaccine rollout plans, Health Minister Dr. Zweli Mkhize apologized on behalf of government, saying it's all been due to several factors beyond government's control, like non-disclosure agreements with manufacturers. He, however, gave a progress report.
We have now secured a combined 51 million doses of vaccine in the agreements that have been signed. 31 million from Johnson & Johnson, which is a one-dose vaccine, and then 20 million from Pfizer, which is two-dose vaccine. We have also got a letter that's indicated that there will be some vaccines coming from the COVAX facility. At the moment, they've only spoken about 1.25 million vaccines. And so this means now we can now move ahead with confidence as we finalize our plans for our mass rollout campaign.
On Wednesday, a local court ruled that the drug ivermectin could be prescribed by doctors for COVID-19 treatment. And we asked Dr. Mkize how worried he was about this, given the fact that South Africa's Health Products Regulatory Agency had only given a restricted approval for the use of the drug earlier.
No, I don't have any worry about it. I think we need to understand that this is a new era. So there are new medication that becomes available, and therefore it still has to go through rigorous processes of verifications of safety, efficacy, and suitability for the public. SAPRA is not an agent that blocks people from getting medicine. It's an agency that checks the safety of medication to protect the public.
South Africa expects to conclude the first phase of the vaccine rollout early next month. Phase 2 begins from the 17th of May to the 17th of October, and Phase 3 soon after, and may stretch into early next year. As at today, nearly 300,000 health workers have been vaccinated with a single-dose Johnson & Johnson vaccine. The minister says the rural areas will be prioritized for the single-dose vaccine as well because of limitations like storage. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Back in Nigeria, we continue with some of the misinformation surrounding the coronavirus pandemic as well as vaccinations. Joining us in Lagos is pharmacist Foluke Akiniroye, a member of the Nigeria Academy of Pharmacy, also CEO Right Source Pharmacy Limited. Thank you for joining us on the program.
Thank you.
What's the most common myth that you've heard since the pandemic started?
They actually believe that COVID-19 is actually for the rich, that it doesn't affect the poor. They do not believe that in Africa that we have it because our weather is so hot. They also think that because they say we should use alcohol-based sanitizers and chlorine, that if they drink a lot of alcohol, that they will cleanse themselves from inside out, and that if they spray chlorine on their bodies, that they will also be okay. I've also heard that if they do inhalation, hot steam, that they will be able to also cleanse the nasal path all the way to their lungs, and then they will not have breathing problems.
But another argument is that the numbers appear to be lower in Africa. So what is Africa doing differently from the rest of the continent?
I'm actually thinking that we're not testing enough. I don't think, because today's figure, it says it's less than 200, and I know that the testing was less than 2,000. We're a country of 200 million. What does that tell us? The thing is, Nigerians believe that the COVID has come and gone, and they are living their life. And because there are many factors in Nigeria that actually, the people are battling with, they are not focusing on COVID as a serious disease they need to be mindful of.
But for those who are supposed to be pushing out facts which would counter the myths and counter the fake news, are they doing a good job of it? When
COVID was first discovered, it was actually discovered on my birthday, February 27th, the first case. And when the information we're getting from WHO as a country, You know, the government kept to it. They did not engage the religious leaders, the institutions, people, that the public that are supposed to assist in disseminating that information to the grassroots were omitted. And that was a major problem, you know, fundamental problem that is leading us to where we are now with the disbelief and all this myth that we're seeing.
Do you see it rolling into the vaccination which has started?
Well, it's actually, you see, Nigeria is a blessed country. And as a member of the Nigeria Academy of Pharmacy, we are the people that are supposed to, we give information. We have professors, we have deans of faculties, we have eminent pharmacists in that body. And we have realized that the information that is required for the public out there isn't enough, and it's making the people resistant. Nigeria as a country is blessed with human intellectuals. Many that leave the country go to other places and are the best in what they do. There is an area that has been omitted in Nigeria, and that is the community people, the private sector, the people that interact day to day with the community that people trust. They see them, they live with them, They have been omitted. The pharmacy, the community pharmacists have been omitted in all this. And that is a major problem, that we're not seeing people trusting the vaccination system and not seeing enough people being vaccinated, because we will have gone a long way. We would have done better if this thing had been routed through the community pharmacists, but it can still be corrected.
All right, a lot more needing to be done. Thank you so much, Pharmacist Foluke Akiniraye, member of the Nigeria Academy of Pharmacy, CEO, Right Source Pharmacy Limited. Thank you for joining us on the program.
Thank you.
And India's Maharashtra state is set to be running out of hospital beds, piped oxygen, a key antiviral drug, as a second wave of coronavirus infections swims the country's state. Here's more on our global update.
India's Maharashtra state is set to be running out of hospital beds, piped oxygen, and a key antiviral drug as a second wave of coronavirus infections hits the country's richest state. The state accounts for nearly a quarter of India's 12.7 million coronavirus infections. If the state were a country, its caseload of more than 3 million would be the 10th largest in the world. New Zealand has temporarily suspended entry for all travellers from India, including its own citizens, for about 2 weeks, following a high number of positive coronavirus cases arriving from the South Asian country. The move comes after New Zealand recorded 23 new positive coronavirus cases at its border today, of which 17 were from India. The suspension starts from 4 p.m. local time on April the 11th and will be in place until April the 28th. During this time, the government will look at risk management measures to resume travel. The number of cases in the United States are still rising, still above 30 million, with death toll surpassing 600,000. A highly infectious variant of the virus that was first detected in Britain has become the most common source of new infections in the country. The B.1.1.7 variant, which first emerged in Britain in December, spreads more readily among young people. Authorities are urging people to get vaccinated as soon as possible to prevent the variants from spreading quickly and widely.
COVID-19 is still real. Continue to take responsibility. You can visit our websites for further updates, a better understanding of the pandemic. You can find several other stories there: politics, business, sports, the latest from Africa and the rest of the world. It's channelstv.com. That's the program. Thank you for watching. I'm Millicent Nwaka. Stay healthy.